Okay, we're going to move rapidly on, so hopefully 2 10-minute talks, gentlemen. So we have time for questions. So just come up. Peter Wurtz has done a lot of work on NMR, and he's going to tell us, he works in Nightingale. So Peter, tell us about metabolomics and your particular vision.
Yeah, thanks, Naveed. It's a great pleasure to be here today and to tell about some of the most exciting scientific project that I've ever been part of that we are now announcing today. So the talk will outline some of the aspects of how detailed metabolic profiling can really help to enrich the UK Biobank data resource. So many of us work to realize the promise of personalized medicine, but a key challenge for that is to, in order to understand all these data for the individual levels, you first need to measure them at large-scale studies, such as UK Biobank. And I think today we've seen talks about genetics, how this is now starting to become true by measuring these panels at very large biobank scale. Then we start to better understand the role of these data for the individual. So UK Biobank have really raised the bar for the genomic data and the healthcare records integration. But one key aspect that has been missing is really this detailed metabolic profiling or molecular profiling from blood samples. But if you have such detailed metabolic profiling, you can really better understand and use also the other layers of data available in large-scale biobanks, such as the genomic data, all the clinical phenotyping, imaging, questionnaire data, and disease endpoints. So you really add value to the biobank by also having molecular profiling at very large scale. Well, until recently, there has been technical limitations to make this happen at the scale of studies like the UK Biobank, but this is now changing. So we are proud to announce that Nightingale and UK Biobank together will engage on this new initiative to measure all 500,000 blood samples, really with the goal to enhance biomedical research and also with a view towards take this to clinical applications. So this project will be conducted over the duration of 30 months from the initial commencement of the blood analysis expected in the beginning of next year. So how are we going to enrich the UK Biobank resource with this detailed metabolic profiling? So Nightingale has developed this NMR-based metabolomics technology, which from a single blood sample, a single experimental run, captures a comprehensive metabolic profile of both lipid measures and small molecules circulating in the bloodstream. So if we look into detail, what are these molecular biomarkers that will be provided to the UK Biobank resource? These cover measures of cholesterol and triglyceride metabolism, both existing measures used in clinical practice and much more fine-grained measures of lipid metabolism, fatty acid concentrations like omega-3 reflecting dietary intake, other fatty acids reflecting also adiposity, ketones, glycolysis-related metabolites, markers of inflammation, and for instance, amino acids, for which many of these have been shown to predict the risk for future type 2 diabetes, heart disease, and even neurological diseases later in life. And one particular fine-grained profiling will be on the lipoprotein lipid metabolism, where we capture lipoprotein subclasses carrying the cholesterol, triglycerides, and phospholipids in the blood circulation, with obtaining a much more fine-grained information than the routine lipid panel provides. So altogether, there's 225 metabolic measures that will be provided by this assay. So why are we so excited about this? Well, Nightingale is specializing into this comprehensive metabolic profiling using NMR metabolomics, And we've conducted quite a number of studies in much smaller cohorts with around 500,000 samples or so measured from biobanks and trials, and quite many scientific applications already showcasing added value to biobanks and trial studies. But now, going to the scale of UK Biobank, we expect that this is now changing the game and really enhancing the possibilities to do better biomedical research and also uncover novel clinical applications. So really the scientific opportunities how to use this data in connection with all the other rich data available in UK Biobank is just endless. So it's ranging from biomarker discovery, better understanding of disease mechanisms on a molecular level, molecular readout of various lifestyle effects like diet and physical activity, and so all the way towards health tracking and realizing the goal of precision medicine. I'm just going to highlight 3 examples here. So one example is combining this detailed metabolic profiling with the vast resources of genetic data available in the UK Biobank, where we get for many of the genes more comprehensible molecular readout what these genes are doing on the molecular level as seen in the blood concentrations of biomarkers in all these individuals. And so we can then better understand how a genetic basis is regulating metabolism, but we can also use the genetic data converted around and use that to better understand what is the role of these biomarkers and are they potentially causal for future disease onset. A particular exciting application of this is to look at what are the detailed metabolic profiles for genetic variants that are mimic the effects of known and novel drug targets. So this gives the opportunity to already before the drug targets are tested in humans to see what is the detailed metabolic readout with these, potentially uncovering better molecular understanding of how are the drug effects and even in some cases could highlight potential side effects. And if this application together with genetic data is further combined with profiling of randomized clinical trial, one can even start to separate the on and off target effects of these different medications. There's some recent application for both statins and PCSK9 inhibitors where we showcase how these detailed metabolic data provide better understanding of the molecular mechanisms of these lipid-lowering drugs. Another exciting application is the biomarker discovery, which is now can be taken to a whole different level with the scale of UK Biobank. Here is shown some results in a small-scale study with around 10,000 individuals on looking at metabolic profiling and the future risk for heart disease and stroke, where we uncovered novel biomarkers predictive of future heart disease risk, as strongly predictive or even stronger than LDL cholesterol. And we see examples where if you subdivide the individuals into young and old individuals, and so then you can start to uncover for which patient groups are these novel biomarkers relevant, and with the goal to really enhance eventually clinical decision-making based on these biomarker data, so you can better improve the prediction of future disease risk, so you can target prevention to the right individuals. But in addition, you can also better track the health state over time, so the molecular effects of both lifestyle and pharmacological interventions. So we are pretty excited about this initiative, and kind of there's many studies with cohorts done already that have highlighted the potential of metabolic profiling to kind of to better predict future disease risk and realize some of the promise of personalized medicine. But there has really been the technical limitations to go to the scale of studies like UK Biobank. But it's clear there's a call from both the research and clinical community that can we advance these detailed molecular profiling technologies to the scale, to the throughput, and low cost and standardization required for clinical use. And we believe that this initiative, together with UK Biobank, is giving a major leap towards realizing that goal. So we look forward to work together with the biomedical research community, really, to unleash the promise of this detailed metabolic profiling at unprecedented scale. Thank you.